Hi, classmate. My name is Samson Oswald, and for our week 1 assignment, which is the elevator speech on the role of the nurse practitioner. Question number 1, by definition, a nurse practitioner is a registered nurse who has completed advanced education and training to assess patient need, interpret diagnostic tests, diagnose illnesses/diseases, and prescribe medication as needed. A nurse practitioner works independently or alongside a physician to offer patient care. In most rural areas, nurse practitioners act as a primary care provider. Among other roles, nurse practitioners majorly specialize in disease prevention and general health promotions. Nurse practitioners uses a holistic approach to assess the needs of a patient and implement a care plan to enhance the patient's health and well-being. According to American Association of Nurse Practitioners, nurse practitioner is educated at the graduate level to provide primary, acute, and chronic care to patients of all ages, depending on the nurse practitioner's scope of practice. And for question number 2, many people in the society do not understand the differences between a physician assistant and a nurse practitioner. But one of the main differences lies in their approach to patient care. The nurse practitioners are trained nurses. The scope of practice for the two professions also varies greatly. Even though the scope of practice for both professions revolves around medical diagnosis of acute and chronic illnesses, ordering and interpreting diagnosis tests, and then prescribing medications, their focus often differs as well. The physician assistant uses a medical model approach which focuses on disease management and treatment, while the nurse practitioner uses a nursing approach which focuses on patient care relative to the specific specialty of the nurse practitioner. The NP can specialize in different specialties like adult care, pediatrics, women's health, and also mental health. The PA have a more generalized studies and can also specialize in areas like the emergency room or general surgery. For the number 3 question, the difference between a nurse practitioner and a physician. Well, the first thing I'll say to that is that physicians have more years of education and training compared to a nurse practitioner. The nurse practitioners are licensed by the nursing board, while the physicians are licensed by the medical board. So apart from the training and education, one of the main differences is also in their style of giving patient care. The physician uses the medical model of care, which focuses on diagnosing and treatment of different diseases, while the NP uses the nursing model, which focuses on treatment of diseases and how humans respond to the treatment. The nursing model of care tends to be holistic. On certification, physicians across all states are obligated to assess and prescribe medication to patients as part of their primary duties. But on the other hand, nurse practitioners acquire the privilege to prescribe but are subject to the state law governing advanced nursing practice. In some states, nurse practitioner services are directly overseen and supervised by a physician. And lastly, number 4 question, why don't you just become a physician? Well, there are several reasons as to why I cannot become a physician. My initial training lies within the nursing profession, which is different from that of a physician. And secondly, my family obligations at this time will not allow me more years of schooling to qualify me as a physician. So I intend to specialize as a medical health clinician for now, and then see how things go. Thank you, class.